Just days after a second migrant child died in U.S. custody, the Secretary of Homeland Security is heading to the U.S.-Mexico border. Christian Nielsen will be in El Paso, Texas today, Yuma, Arizona tomorrow, and her trip comes as a top Senate Democrat says she wants the Senate to investigate now those children's deaths. The White House says the tragedies show exactly why the nation's immigration laws need an overhaul.
Certainly, that's an absolutely tragic situation, something nobody ever wants to see happen. It's one of the reasons that the president wants to fix our broken immigration system. It's a treacherous journey, and we don't want to see people go that route. We are doing everything in our capacity to make sure that when people do come, that they're taken care of so that we don't have these type of instances. In many cases, they show up extremely dehydrated, without food, and they're seeing a doctor for the very first time.
CNN senior medical correspondent Elizabeth Cohen is joining me now with more on this. Elizabeth, you're learning more about what happened to that 8-year-old boy who died on Christmas Eve.
Right.
What are you learning?
Kay, what we're hearing is that they did an autopsy and they tested for the flu, and he had the flu. Doctors have been telling me this for days, that it sounded like he had the flu, but it appears he was never tested for the flu, even though he had symptoms of it. Let's do a TikTok of what happened. On December 24th at 1:20, he was taken to the hospital with, according to Customs and Border Protection, symptoms of the flu, possible symptoms of the flu, yet there's no mention that he ever got a flu test. So why was he brought in with symptoms of the flu, including a 103-degree temperature, and it appears never tested for the flu? We've asked that question. We have not gotten an answer. He was diagnosed instead of the flu with a common cold, and he was released back to the detention center. Then at around 11 o'clock that night, he was brought back to the hospital because he had gotten sicker and sicker. Not surprising when a child has the flu. And then they tried to revive him, but at 11:48, he was pronounced dead. So lots of questions about why he didn't get a flu test, including, let's take a look at a map that just came out moments ago from the CDC. Look, and in the Southwest, Arizona, New Mexico, widespread flu activity. Texas has the second level, a little bit of a lower level of flu activity. Now, this map is new, and so the map that would have been available to these folks when this boy was sick was a little different. There wasn't quite as much flu activity, but still, even then, high levels of flu activity when this boy was sick. He had symptoms of the flu. It appears he wasn't tested for the flu. Why not?
Sarah Sanders, you heard her there. She said today that they're doing everything in their capacity to make sure that people crossing the border are cared for. You've been talking to experts kind of about this. What do they think?
You know, they really question what they said. They think Sarah Sanders is just wrong. They said, look, obviously everything wasn't done for this boy. CBP, the government, has medical professionals. Why didn't they insist on a flu test? Why didn't they tell the hospital he has signs of the flu, do a flu test? They knew he had signs of the flu. Secondly, this boy was sent back to a crowded detention center, or I should say to a detention center, many of them are crowded, with a 103-degree fever. He had just had a 103-degree fever, and he's sent back to a detention center. It's not great health care for him. And what about for everyone else who was there? Flu can spread like wildfire, and you're sending a child who just had a 103-degree temperature back to a detention center with many other people. The third question that experts have, Kate, is they want to know, were these children, or really anyone else, vaccinated upon entrance? Vaccinating people is very, very easy. It is not expensive, and it's very effective. Were they vaccinated for the flu when they were admitted to these centers, or for any other contagious disease that could save lives?